Thank you for joining us tonight for this Medicare webinar series, and tonight's topic, Medicare Eligibility and Coverage for Parts A and B, presented by the Pikes Peak Area Agency on Aging. We want to thank the Pikes Peak Library District for their partnership and support of this webinar series. Before we begin, we ask that you please mute your microphones until we reach the question and answer portions of the presentation, or we ask that you please use the raise hand function to let us know if you have a question. And now it's my pleasure to introduce our presenter, Roma Costanza, State Health Insurance Program Coordinator and Case Manager at the Pikes Peak Area Agency on Aging.
Thank you, Jared. So good evening, everyone. Jared, it looks like that last person that's trying to get in is having a little problem.
Or continue to try to get her in. Yep.
All right, thanks. All right, so good evening, everyone. Thank you for joining us and thank you for your patience. We're running a little bit behind today because my email didn't actually go out my outbox earlier today with the reminder for tonight's presentation, but I do appreciate you joining us. As Jared said, please stay on mute, but I will be pausing throughout the presentation to see if anybody has any questions. So when I make pauses, you're welcome to unmute and ask your question. You can use the raise hand option within the Teams app here, or you can type your question into a chat box at any time. We've got a lot of information to go over. Hopefully you did receive the email that I sent out just a few minutes ago that included all of the handouts that I will be referencing with tonight's presentation, as well as a copy of the slides. And I think that's all the housekeeping. We do have a lot to go over, so I'll try and get us through it as quickly as we can. But again, please don't hesitate to ask questions when I take a pause for questions. So again, thank you for joining us. Tonight we are starting part 1 of our 4-part Medicare 101 series, everything you never wanted to know about Medicare. Tonight, we're going to be talking about Medicare eligibility and coverage, and that's going to include how to enroll and the costs associated with Medicare. We're going to start with who I work for. So I am with the Pikes Peak Area Agency on Aging through the Pikes Peak Area Council of Governments. The mission of the Area Agency on Aging is to work with our community governments, which include El Paso, Park, and Teller counties, to develop and coordinate systems that allow people to stay in their communities for as long as possible. We are also doing this in partnership with the Pikes Peak Library District, whom we've partnered with for several years now, and we really appreciate their partnership and working with us. So I am with the SHIP program through the Senior Insurance Assistance Department at the Area Agency on Aging. The SHIP program, which stands for State Health Insurance Program, it's a federally funded program that provides free and unbiased information and education on all things Medicare. So we do not endorse any specific companies or products. We are here to simply educate you on all the things that you need to know. And we do that for a total of 9 counties here in Colorado. Every county and every state has access to a SHIP program, at the very least by a statewide toll-free number. So I have listed both our local Colorado Springs number for those 9 counties, as well as our statewide toll-free number, which would route you to the closest SHIP office from wherever you're calling from in Colorado. All right, so tonight we are going to talk about 2 parts of Medicare. But overall, we are going to talk about all parts of Medicare throughout our 4-week process. So we're going to start with Medicare A and B, and we're going to start with who runs Medicare. It is Social Security, or the Social Security Administration, who determines who is actually eligible for Medicare. And they do that by keeping track of income, wages, and taxes paid through work income. So Social Security determines who's eligible for Medicare. They are actually who you have to go to enroll in Medicare. Only Social Security can enroll you in Medicare. They provide the Medicare cards, and they are available through their nationwide toll-free number Monday through Friday from 7 a.m. to 7 p.m. in all time zones. You can also access your information or ask questions through the Social Security website, ssa.gov. I've also provided our local Colorado Springs office address and phone number. Once you're enrolled in Medicare, Social Security wants nothing to do with it. And if you have any questions that pertain to your benefits or claims or eligibility or anything like that, you would want to direct those questions to the Centers for Medicare and Medicaid Services, also known as CMS. I simply refer to them as Medicare. So once you're enrolled in Medicare, you would contact Medicare directly if you have questions about your benefits, because they administer the program, they process the claims, they pay the providers directly. Medicare does not have a brick and mortar location anywhere. The only way you can contact Medicare is by their nationwide toll-free number, which is available 24 hours a day, 7 days a week, 365 days a year. Or you can go to their website, medicare.gov. If you want to call them, it's 1-800-MEDICARE or 633-444-4227. But again, there is no brick and mortar location for Medicare. You can only contact them either by phone or online. So let's talk about who can have Medicare. Basically, any U.S. citizen who attains age 65 or older and has contributed into the Social Security tax system through payroll taxes is going to be entitled to Medicare at age 65. Also, anybody who has been determined to be disabled and has received Social Security disability income payments at any age will be automatically eligible for Medicare after 24 payments. Anybody who is diagnosed with kidney failure or end-stage renal disease and is receiving dialysis can become eligible for Medicare at any age. Anyone who is diagnosed with Lou Gehrig's disease or ALS can also become eligible for Medicare at any age. And any lawfully admitted resident alien who has resided in this country for at least 5 consecutive years and turned 65 is eligible to purchase Medicare. When should you enroll in Medicare? These days, many people tend to work past age 65. But age 65 is typically going to be your initial eligibility opportunity. So everybody becomes eligible at age 65 no matter what, unless you fall under another situation. So you don't have to be retired to enroll in Medicare, but you don't have to enroll in Medicare if you're not retired. When you're approaching eligibility based on age, based on turning 65, you have what's called an initial enrollment period. That initial enrollment period is a 7-month window that surrounds your 65th birthday, and it includes the 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and up to 3 months after the month of your 65th birthday. That 7-month window is your initial enrollment opportunity where you can enroll in Medicare during any of those months without penalty. There are other times which you can enroll that we will talk about. But that is what most people will fall under, is that initial eligibility. So other enrollment periods, there is a special enrollment period that some people may fall under, and this is going to involve people who decide to continue to be employed and have employer health coverage through that employment and decide to delay enrollment into Medicare in favor of that employment and employer health coverage. And then there's the general election period. So if you don't enroll in Medicare when you're first eligible during your initial enrollment period, you don't fall under a special enrollment period because you continued to work. You would still be able to enroll in Medicare any year down the road during the general enrollment period, which is January 1st through March 31st each year. And I haven't corrected the slide, so I apologize. But if you enroll during the general election period, your coverage would actually start the first day of the following month. This is what the Medicare card looks like these days. It will simply have your name It'll have your Medicare ID number, which is just a random series of letters and numbers. And it will indicate when your Medicare Part A and your Medicare Part B go into effect. And that is all it will ever indicate. I also refer to it often as the red, white, and blue card. Just a couple of notes to think about when you're getting ready to enroll in Medicare. It's really, really important to make sure that your mailing address is up to date at Social Security. If you have moved and Social Security does not have your current mailing address on record, and if they try and send you a Medicare card and they send it to the wrong address, there is potential that someone could get their hands on your Medicare card and use it fraudulently. So it can be very important to make sure that that card actually comes to you. On the other hand, if anyone tries to contact you to try and verify that you received your Medicare card or verify that your Medicare number is correct, that is not going to be a legitimate call, because Social Security nor Medicare will ever call you for that purpose. Honestly, Medicare will never call you. Social Security may call you, but they will only call you if you ask them to. So if anybody calls you or contacts you by text or email, suggesting that they are with the government and entities such as Social Security or Medicare, those are not legitimate contacts, and I would be wary of providing any information to those contacts. In the email that I did send out just prior to starting this presentation, I included several handouts. Two of those handouts were regarding Social Security's website and the types of information that you can get from the website and how to get it. So this one is just listing several different things that you can do on the Social Security website. I also included a handout on how to create a personalized Medicare.gov account. You can also create a personalized Social Security account on the Social Security website. Both Medicare and Social Security do strongly encourage you to create your own personalized accounts on those websites, but it's not required that you do so. So you do not have to, if you enroll in Medicare through Social Security's website, you are not required to have an account to do that. You can do that without an account, but there are a lot of benefits to having accounts both at Medicare.gov or SocialSecurity.gov. And you know, some of those attributes would be to be able to access your personal information within seconds versus trying to call Social Security and sitting on hold for Lord knows how long before you get a human being on the phone to try and ask your question or get the information that you're looking for. By having these personalized accounts, you would be able to access your information much, much quicker. All right. Any questions about anything we've covered so far? Again, if you have a question, you can simply unmute and ask it. You can raise your hand or you can type a question into the chat at any time. All right. I don't see or hear any questions, so we are going to move on. So we are going to start with Medicare benefits, and we're going to start with Medicare Part A. So I get a lot of questions, surprisingly, about whether or not people actually need to sign up for Part A. And there's a couple things you'd want to take into consideration when making that decision. There are some beneficiaries who may automatically become enrolled in Medicare through Social Security without having to do anything. Typically, that is going to be anybody who is already collecting a Social Security income of any kind for any reason when they become eligible for Medicare. So, for example, if you have been determined to be disabled and you're receiving disability income payments from Social Security, after your 24th payment, Social Security will automatically enroll you in Medicare. If you have started collecting Social Security income early as age 62, you will automatically be enrolled in Medicare when you turn 65. If you're not already collecting a Social Security income for some reason, when you are approaching age 65, it will become your responsibility to contact Social Security if you want Medicare to start when you turn 65. However, keep in mind that if you are still actively employed, your employer has 20 or more employees, and you have health insurance through that employer, you can delay enrollment into any part of Medicare in favor of that active employment and employer health coverage. If you choose to do so, you would be able to enroll in Medicare down the road or when that employment ends without penalty. It is basically the only excuse Social Security will accept for not enrolling in Medicare when you first become eligible and not penalizing you for enrolling late. And I will reiterate that point several times as we go on. For most people, Medicare Part A is at no cost. And that is simply because you have worked and paid into the tax system, or your spouse worked and paid into the tax system. In order for anybody to be eligible for Medicare Part A at no cost when they turn 65, they would have had to contribute into that system for a total of what they call 40 working quarters or 40 working credits, which is the equivalent of 10 years worth of work history. And that 10 years worth of work history can be accumulated at any time during your lifetime. So whether or not you accumulated that work history because you started working when you were in high school and have worked nonstop since then, or if you accumulated that 10 years with part-time work over the course of a 30-year period. As soon as you have accumulated a total of 10 years worth of work history, you will automatically be eligible for Part A at no cost. If for some reason you do not meet that 10-year requirement when you turn 65, you can purchase Part A, but it's not cheap. Medicare Part A for people who don't have that 10 years worth of work history would cost about a maximum of $506 per month this year. And that premium does go up every year. But again, if you are a spouse or even an ex-spouse of someone who has that work history and you do not, there is a potential that you could still get Part A at no cost based on that spouse's or ex-spouse's work history, as long as you were married at least 10 years or have been married at least 10 years. If you're not sure if you have enough work history to get Part A at no cost, you would have to contact Social Security and ask them. They're the only ones that could tell you. So what does Part A cover? So Medicare Part A is basically going to provide you with any inpatient coverage. Primarily, that inpatient coverage is going to be for inpatient hospital stays. So if you have the need to be admitted to a hospital as an inpatient for whatever reason, Medicare Part A will cover the entire cost of that hospitalization, whether it's $50,000 stay or a $500,000 stay. They'll pay all of it except for a deductible. For this year, that deductible per admission is $1,600. That deductible can be applied multiple times in a year if you're admitted to a hospital multiple times in a year. That deductible covers you up to 60 consecutive days. So again, Medicare doesn't care if it was a $50,000 inpatient stay or a $500,000 inpatient stay. They'll pay everything except for that $1,600 deductible per admission. If for some reason you're in the hospital longer than 60 days, Medicare will continue to pay for that stay, but they will start applying what they call a coinsurance, meaning they'll continue to pay everything for that stay except for this year, starting at day 61, would be a $400 coinsurance per day. If you're there longer than 90 days, that coinsurance goes up to $800 per day, and you start going into what they call lifetime reserve days. This would have to be consecutive days stay in order to get to those coinsurance levels. Otherwise, you're covered up to 60 days at just that $1,600 deductible. In order for Medicare to apply another deductible in any given year, you would have to have at least 60 days from the time you're discharged from a hospital before you're readmitted to a hospital before a new deductible could be applied. So there has to be at least 60 days in between hospitalizations before they can apply another deductible. If there's less than 60 days and you have to go back into the hospital, you technically would be in the same 60-day window or benefit period, and they would not necessarily apply that deductible a second time. Medicare actually considers a 90-day hospitalization as a full benefit period for this benefit. Honestly, most people are in and out of the hospital faster than they probably want to be. And the hospitals tend to get you in and out fairly quickly. So it would be an extreme situation for anybody to be in the hospital for 60 days or longer. Medicare will pay for inpatient hospital stays as often as you might need them. There is no limit to how long or how many times they will cover an inpatient hospitalization. Medicare will also cover inpatient psychiatric hospitalization, but they do put a limit on how many times they will pay for that. And it's a 190-day lifetime maximum benefit for psychiatric hospitalizations. While you're in a hospital as an inpatient, there are some things that Medicare will not cover as part of that stay. Medicare will not pay for you to have a private room while you're in the hospital, unless it's deemed medically necessary by the doctor. No part of Medicare will pay for any of the first 3 pints of blood someone might need replaced. Don't ask me why. I have no idea. After all these years, I've never gotten a straight answer for that. Also will not cover private duty nursing while you're in the hospital or room sitters. And it will not cover what's called self-administered drugs. Typically, self-administered drugs are only going to be an issue on the day of discharge. On the day of discharge from a hospitalization, technically you're no longer an inpatient. But if it's taken them all day to discharge you, and in the meantime, it came time for you to take your maintenance medications, and they bring you a cup of pills with those medications in it, and you take that cup and you swallow those pills, you just self-administered medications, and they can technically bill you separately for that. All right. Also, Medicare Part A does cover skilled nursing facility or skilled rehab after a inpatient hospitalization. And this is going to be for recovery or rehab, physical therapy after you've had a hospitalization. Medicare does require that you are an inpatient in the hospital for at least 3 days prior to being discharged to a rehab for rehab or recovery. If you meet that 3-day hospitalization requirement and you're discharged to rehab for recovery, Medicare will pay 100% for that inpatient skilled facility stay. And they will pay 100% for up to 20 days. If for some reason you're still in that skilled facility for rehab or recovery after 20 days, then Medicare will continue again to pay for that stay, but they will start applying a daily coinsurance. And this year, that daily coinsurance is a flat $200 per day, starting at day 21. Again, this is a continuous day stay. So Medicare pays 100% for the first 20 days of any skilled facility rehab you might need. They will pay everything but $200 per day, starting at day 21, all the way through day 100. Medicare will pay all or part of up to 100 days at a time in a skilled facility situation. They consider that 100 days as a benefit period, and they will cover an unlimited number of these benefit periods if you need them. Again, you would have to have at least 60 days from the time you're discharged from an inpatient rehab to the time you're readmitted to an inpatient for rehab before a new 100-day benefit period would start. Medicare will only cover up to 100 days in a skilled facility for rehab or recovery because they have basically determined that if you have not gotten well enough to go home after 100 days, even if you go home and have continued care at home, such as at-home physical therapy or what have you, if you have not gotten well enough to go home, the likelihood of you being able to go home becomes pretty slim. Most rehab stays after a hospitalization are 4 to 6 weeks on the outside. So 100 days they've determined is the cutoff. If you are still in that skilled facility on day 101, Medicare coverage stops completely, cuts off completely. And at that point, you're looking at continuing your stay in that facility either on a private pay basis, or you may have had the opportunity to purchase long-term care insurance, and that will help cover the cost of your continued stay, or you may qualify for Medicaid to help cover the cost of your continued stay in that facility. But again, there's a limited number of these benefit periods that you're allowed to have, but they do require that 3-day inpatient hospital stay or longer before Medicare will cover that service. The last benefits covered under Part A are going to be in-home health care and the hospice benefits. Both of those services do require a doctor's certification testifying to your eligibility for those services. If a doctor can provide that certification of eligibility, any costs for those services, there's no deductible. Medicare pays for them at 100%. For in-home healthcare services, keep in mind that Medicare will only pay for services that are deemed medically necessary. So what that means is they will pay for a therapist to come in and do physical or occupational or speech therapy with you. They'll come in to have a medical professional provide wound care or, something like that, whatever you're in the hospital for. What it will not pay for is homemaker services. So even if you don't have someone else that would be able to help you with meal preparation or, stuff like that, that's not something Medicare would pay for under these benefits. If a home care agency also recommends and provides to you, say, a walker or a wheelchair or something like that while you're at home, that would fall under a different part of Medicare, and there could be a 20% coinsurance that you would have to pay for those items. Other than that, there are very few limits to those benefits. The hospice benefit of Medicare Part A is basically an end-of-life benefit. And what the hospice benefit is designed to do is provide whatever services they can, pay for whatever services they can that are designed to make you as comfortable as possible in an end-of-life situation. So it will pay for home care. It will pay for medications, pain medications. It will pay for social services. It will pay for pretty much, again, anything that will make you comfortable. It'll pay for medical equipment, hospital bed, wheelchair, walker at 100%. It will not cover anything that is not going to be designed to just make you comfortable. And it will not pay for room and board. So if you are still in a skilled facility or in a facility, when you go on hospice, every service you receive in that facility would be paid for by Medicare, except for the room and board, the cost of being there. So again, basically Medicare Part A covers inpatient services only. And that is Part A in a nutshell. Any questions about any of that? Again, if you have questions, you can unmute and just ask your question.
So Medicare Part A is not income-based or anything. Everybody over 65 gets that?
Absolutely, and you get it at no cost as long as you pay taxes or had employment taxes paid into the system.
Okay.
Yep. Any other questions? All right, so let's move on to Part B. So rule of thumb, Medicare Part A covers your inpatient services. Medicare Part B is going to cover your outpatient services. Same things to take into consideration. If you're already collecting a Social Security income, you will automatically be enrolled in Part B as well as Part A. Medicare Part B is the part of Medicare that everybody pays for. Again, if you are actively employed and have employer group health coverage through that employment, or you're the spouse of someone who is actively employed and you're covered through their employer group health coverage, you can delay enrollment into any part of Medicare in favor of that employer, employer health coverage. And when that employment ends, you actually get an extended amount of time to enroll in Medicare without penalty. So if you delay enrollment into Medicare, into any part of Medicare, because you're actively working with health coverage, when that coverage ends, you get 8 months, an additional 8 months to enroll in Medicare without penalty. If you miss that window and you enroll in Medicare, say during the general enrollment period, that's when penalties will start coming into play. And we'll talk about that in the next slide or so. But again, everybody pays a premium for Medicare Part B, and Medicare Part B can be income-based as far as what you might have to pay for it. There are some situations where you might have to enroll in Medicare Part B. If you're looking at purchasing any additional insurance that's designed to coordinate with Medicare, such as a Medigap policy, or you want to enroll in a Medicare Advantage plan, you have to have both A and B of Medicare. You can't have one or the other. You have to have both. If you're retired military and you are accessing your TRICARE benefits and you become eligible for Medicare, TRICARE does require that you enroll in both A and B of Medicare when you're eligible in order to keep TRICARE benefits. TRICARE benefits prior to Medicare change automatically to TRICARE for life benefits when you enroll in Medicare. If you are actively employed and retired military, again, you can delay enrollment into Medicare without it affecting your TRICARE benefits because you are actively employed with health coverage. So it wouldn't affect your ability to get TRICARE once that employment ends. If you are a veteran, and I do get a lot of veterans ask if they need to enroll in Medicare, especially if they tend to use the VA health system as their primary medical need. So if they're getting all their medical services and all their medical needs met through the VA system, they tend to wonder why they would need Medicare and why they would want to pay for Medicare if they're using VA. And my answer to that is the VA system is great, but it's not always readily available. So if you use the VA system as your primary care, that's great. You are entitled to those benefits. You should be using them. But there's not a VA hospital around every corner. There's not VA medical facilities in every area. And the benefit of having Medicare and VA is that Medicare is good everywhere. Anywhere in this country with any provider who takes it for any medical need, anytime. So it gives you instant access to medical care no matter where you're at or what you need. So there are advantages. And if you're a veteran and you choose not to enroll in Part B because you do use the VA system, but for some reason down the road you find that having Medicare Part B would be a good idea or advantageous, again, you'd be able to enroll in Medicare Part B during the general enrollment period whenever you want, any year down the road, but you would have to pay a higher premium in the form of penalties for not having enrolled when you first became eligible. VA is not a good excuse for not enrolling in Medicare and not being penalized. So again, and I keep hammering this point in over and over, if you're still actively employed and have employer group health coverage, you can delay enrollment into Medicare A or B or both. And you will get that special enrollment period when that employment ends with the extended 8-month window to enroll in Medicare without penalty. And again, if you miss that window of opportunity, you can enroll any year down the road between January 1st and March 31st. Coverage starts the first day of the following month, but that's when penalties start being applied to what you pay for Medicare Part B. So what does Part B cost this year? For most people, Medicare Part B is going to cost $164.90 per month. If you're collecting a Social Security income, that premium will automatically be deducted from your Social Security income from day one. You have no choice about that. If you're not collecting a Social Security income when you enroll in Medicare, because you're going to wait for full retirement age or what have you, then it becomes your responsibility to pay for that benefit directly. You can, they either will bill you quarterly for that monthly premium, or thankfully they have recently arranged for electronic bank draft where they can just deduct it from your bank account every month electronically. But again, if you're not collecting a Social Security income when you become eligible for Medicare, it becomes your responsibility to contact Social Security and tell them you want to enroll in Medicare. If you're not going to enroll in Medicare at 65 because you are continuing to work, you do not need to tell Social Security that. They don't care. They don't care if you're going to delay enrollment because you're still working until you stop working and try to enroll down the road. At that point, you will have to provide a document from the employer. It's a form that they have that you take to the employer for the employer to fill out that verifies that you were still actively employed and had health coverage through the employment. And that's what keeps you from being penalized down the road. But in the meantime, they do not need to know, they don't want to know that you're not going to take Medicare at 65 in favor of working. If for some reason you are imposed a penalty because you did not enroll when you first became eligible and you did not have active employment as the reason for not enrolling, if you are imposed a penalty because you didn't enroll when you should have or could have, the way they calculate that penalty is they are going to take 10% for every full 12-month period you did not enroll in Medicare but could have. Multiply that by the number of years you waited, and then multiply that by that year's Part B premium. So for example, if you waited 3 years to enroll in Medicare and you weren't actively employed, you'd be looking at potentially a 30% penalty, 10% times 3 years. They're going to take that 30%, multiply it by $164.90. Whatever that comes out to is going to be tacked on top of the $164.90 every month forever and ever and ever and ever. Once you incur a penalty to your premiums for Medicare, they never go away. So I really, really encourage people not to incur penalties if you can help it, because even if it's only 10%, which would be what, $16, $17 a month, $16, $17 a month over the next 10 or 20 years adds up to quite a bit. Also, Medicare Part B premiums have become means tested. What that means is that Medicare Part B premiums can now be dependent on actual earned income. So if you have a high income and the threshold starts at like $97,000 a year for a single person, if you have an income greater than that, you may pay automatically a higher Part B premium simply because you have a higher income. The way Social Security is going to determine who has to pay that higher premium is going to be by looking at your IRS income tax filing for the most complete tax year. What that means is we are just now filing taxes for 2022. theoretically, your tax filing for 2021 is complete. So they're going to look at your tax filing for 2021. If you were still working in 2021 and had a high income, and they look at that income, you could get a letter in the mail that says you have to pay a higher Part B premium based on that. If you've in the meantime retired and your income is no longer at that level, unfortunately, that's not much you're going to be able to do about it at the time. But Social Security does look at those records every year. So if the next year they look at your tax filing and they see that your income has gone down because you have retired, then the premium will go down as well. So just because you're assessed a higher premium based on a higher income from a year ago or a year and a half or 2 years ago does not mean you'll be stuck paying that higher premium forever. It will fluctuate as your income fluctuates. More Part B services. Medicare Part B does have a deductible as well, but it's an annual one-time-a-year deductible. For 2023, that one-time-a-year deductible is $226. A drop in the bucket compared to most deductibles these days. Once that deductible is met, Medicare Part B pays for outpatient services, typically at an 80-20 split. They pay 80% and leave a 20% balance, potentially for you to pay. Here's a chart of the means testing income thresholds. Again, the threshold for a single person is starting at $97,000 this year, $194,000 for a married couple. And it goes up to as high as $500,000 for a single person and over $750,000 for a couple. So again, the higher you are in that income chart, the more you're going to pay in premiums. So any questions about any of that?
If you're still working when you turn 65, can you enroll just in Part A and upgrade later to Part B?
Absolutely. And Social Security does encourage that. And they kind of imply that you have to enroll in Part A. So I'm usually very careful to suggest that that's not a have to, it's a want to. But many people will enroll in Part A because it's at no cost. So there's no downside to doing it. Just keep in mind that if you are still employed with employer coverage, Part A would become secondary to the employer coverage for inpatient care only, because it only covers inpatient hospitalizations and such. So if you have an employer coverage with a really high deductible, say a $10,000 deductible, and you have a hospital stay and they apply that $10,000 deductible and you have Part A in place as a secondary, Medicare Part A could potentially pay that deductible, everything except for the Part A deductible of $1,600. So there is benefit to that in some situations. So absolutely, you could do that. But again, it's not required.
Question.
Mm-hmm.
Is there any insurance policy, let's say, to cover that 20% if you go over? Like, let's say your hospital stay was $500,000 and you're responsible for that 20%. How does that work?
So that's not going to happen because Part A for an inpatient hospitalization, Part A is going to pay everything.
Okay.
Everything except for that $1,600 deductible.
Okay. All right. Okay. All right.
So
okay.
your max out of pocket for any hospitalization is $1,600 deductible.
Okay.
But again, that applies whether you're inpatient for 1 night or 100 nights. Doesn't matter.
Wow. Okay. All right.
Okay.
Thank you.
You're welcome. Any other questions? All right. So let's talk about what Part B covers. Again, rule of thumb is Part A is your inpatient, Part B is going to cover your outpatient needs. So Part B covers all your doctor's visits of any kind, specialist or general, covers all your lab and x-rays, including CAT scans and MRIs, covers all medical, surgical, and anesthesia services, and Medicare does cover medical second opinions. Again, no part of Medicare pays for any of the first 3 pints of blood someone might need replaced, but Part B will start covering blood at pint number 4. Covers all your emergency ambulance transports. Has to be deemed an emergency. Covers your annual vaccines such as flu shots, pneumonia shot, shingles vaccine. Covers all your outpatient physical, occupational, and speech therapies. Covers durable medical equipment. That's going to be oxygen, walkers, wheelchairs, in-home hospital beds, that kind of stuff. And there is other limited coverage for things like podiatry, chiropractic, optometry. There's a little more limit to some of those kinds of services, but basically another rule of thumb for Medicare is if it is deemed medically necessary, Medicare should pay for it. It does become your doctor's responsibility to tell Medicare it's necessary and deem it a covered service of Medicare. But as long as the doctor is able to do that, Medicare should cover anything you ever need, any service, any medical service you ever need. There are some things Medicare Part B will not cover. Routine annual physicals are not covered. Routine foot care, hearing aids or the fitting of them, routine eye exams to see if your prescription has changed or the glasses associated with it, not covered. Even if you're at the eye doctor for a medically necessary reason, that you poke yourself in the eye with a pencil, if the doctor does a refraction of your eyes, that would still not be covered. Dental, in any way, shape, or form, is still not a benefit of Medicare. And then, of course, anything deemed not medically necessary, such as cosmetic surgery, would not be covered. So again, rule of thumb for any part of Medicare, medical necessity. If the doctor says you have to have this done, you need to have this done, Medicare should pay for it because the doctor is going to tell Medicare you had to have it done. It was necessary. So even though there are many things that Medicare may not cover, all of these things that Medicare determined routine or not medically necessary, they have been able to make concessions on in some cases. So Medicare does not cover routine annual physicals. Their answer to the routine annual physical is what they call a welcomed Medicare preventive visit or an annual wellness review. What those services are not physicals. What they are in-depth conversations with your doctor once a year, or if you use the Welcome to Medicare preventive visit, it's your initial consultation once Medicare goes into effect, but it's an in-depth conversation with your doctor where they are going to get a sense of your health history, your family's health history, your social history, all of that kind of stuff. It's going to be an in-depth conversation, and that's going to give the doctor an opportunity to perhaps suggest preventive tests that might be of advantage to you based on that information. When preventive care became a really big deal with insurance companies several years ago, Medicare did jump on that bandwagon. And so Medicare does cover many, many, many preventive services. Cardiovascular screenings, cancer screenings, diabetic screenings, just to name a very, very few. As of 2020, Medicare does pay for any and all preventive services that you qualify for at 100%. Again, Medicare covers a lot of preventive services, and the best way to get a detailed list of those services would be to actually get a Medicare and You handbook. The Medicare and You handbook is a booklet that Medicare sends out every year to everybody with Medicare, and they send you a hard copy in the mail, except for the year you turn 65 and get Medicare, because you're not in the system to be on the mailing list. But you can go to the Medicare.gov website and either download that as a PDF or you can call 1-800-MEDICARE and ask them to mail you one specific for Colorado. In that Medicare and You handbook, there is basically a 20 or 30 page section oh, hold on. There's a 20 or 30 page section in that book that details all of the preventive services Medicare pays for, tells you the eligibility for those services, and tells you how often you can get that preventive service. And all the preventive service descriptions are indicated by a little blue apple symbol next to each description. So again, the Medicare and You handbook is the best way to get a complete list of those preventive services. All right, that is Part B in a nutshell. Any questions about any of that? All right, I'm not seeing
Does
any
this
questions. Oh, go ahead.
Does this class cover, I know you have a topic, I saw one of your papers that talked about how you get assistance to pay with, for the 20%, or if your income's low enough that you can't afford those premiums. Is that covered in this class or one of the other classes?
That is actually what we're going to be talking about next.
Oh,
Medicare
great.
savings programs. Yep. All right. So if there are no other questions, let's talk about assistance. So there are programs available specifically and solely for people with Medicare called Medicare savings programs. Medicare savings programs are financial assistance programs for people who have limited or lower incomes that can help at minimum pay the Medicare Part B premium so that that $164.90 is not deducted from your check every month. If your income is limited or low enough, it may also help cover your Medicare A and B deductibles and the 20% for Part B services. If you're approved, if you apply for and are approved for a Medicare savings program, you will also automatically get financial help with Medicare Part D for drugs. To apply for a Medicare savings program, you actually, even though this is a federal program, to apply for this program, you actually have to do a Medicaid application with your local county office. Somehow they've determined that that is going to be the most effective and efficient way for them to process applications for this assistance. So even though it's a Medicaid application at your local county office, this is not a Medicaid program. It's a federal program. There are some people who already are at a lower income limit based on benefits that they are already receiving, such as SSI, supplemental security income through Social Security, or they may already be on some type of Medicaid program, such as OAP or a long-term care Medicaid benefit, or other Medicaid benefits, because people don't realize there are over 40 different kinds of Medicaid in Colorado. If you are already on one of those types of benefits, you will automatically get Medicare savings assistance and assistance with Part D costs for drugs. But because this is a financial assistance program, you do have to meet certain income and asset limits. For 2023, income limits for a single person to get the least amount of assistance, you can have an income no higher than $1,660 pre-deduction. So that would be your gross income before anything would be deducted from that. And that would include income from any and all sources, including Social Security, pensions, interest income, anything that you get on a regular basis. Limit for a couple would be $2,239 gross income. The lower the income you have, so if you're at the $1,600 limit, if you're at the $1,474 limit, at those limits, you're looking at getting assistance with just the Part B premium. If you're at the lowest income level of $1,235 per month, you would qualify for not only assistance on the Part B premium, but that's where you would also qualify for the program to pay your Medicare A and B deductibles and the 20% balances for Part B services. Asset limits for these programs. For a single person, you can have at maximum $9,090 in liquidatable assets, which means checking, savings, money markets, IRAs, annuities, 401ks, that kind of stuff. What they are not going to look at for assets are going to be the house you live in or the property it sits on, not an asset. Your primary vehicle is not an asset. Your personal possessions are not assets. So if you have a $50,000 diamond ring on your finger, that is not an asset. They're going to look at financial accounts, property that you own but don't live on, that kind of stuff. Each of those asset limits also could include an additional $1,500 if you already have a burial or funeral arrangement of some sort, whether it be a life insurance policy or prepaid burial arrangement. We can tack on top of that, of those limits. If you have questions or want more information about these programs, you're welcome to call us. We do help with these applications, completing them and submitting them, as well as we can talk to you about your eligibility. And if for some reason you're not eligible, we can also talk to you about other options that might be favorable to save money for those kinds of expenses. And we're happy to do that at any time. You just have to give us a call. So again, we've about wrapped it up for the night. If you have any questions, if you want to talk to someone on a one-on-one basis, that's what we're here for. This is all we do. We talk about Medicare and Medicare options and how they affect you in particular. So again, this is a federal program. It's nationwide, and every state has access to SHIP counselors in every county. The slide lists our toll-free statewide number, and if you call this number from any of the 9 counties that we cover, you will automatically be routed to our Colorado Springs office. If you call it from a different county, you're going to be routed to the SHIP program closest to where you're calling from. We are not, we do not charge for our services. All of our services are free. And what that means is we are grant funded. And because we are grant funded, we are underfunded, obviously. So if anybody wants more information about the SHIP program in general, or any volunteer opportunities for the SHIP program, please visit the SHIP TA Center website for that additional information, or you're always welcome to shoot me an email or give me a call, and I'd be happy to talk to you about volunteer opportunities or more information. Also, please keep in mind that the Administration for Community Living, which is the federal entity that oversees this program on a national level, is doing a nationwide survey. So if you happen to get a phone call from a third party that is telling you that they are doing a survey because you attended a recent SHIP event or presentation, it is a legitimate phone call. And we appreciate any feedback that you can provide them on how our services were, because it does help continue the funding for this program at a federal level. You will also get an email in the next day or so from us, from the Pikes Peak Area Agency on Aging, with a survey, an internal survey. And we, again, also appreciate your feedback on that to help improve our services and presentations. And we're always open to suggestions for other educational presentations that you might be interested in. This SHIP program also has a sister program that we administer called SMP, or Senior Medicare Patrol. The SMP program is designed to help educate and empower people to prevent and detect Medicare and Medicaid fraud and abuse. So if you are ever in a situation where you are getting a bill you don't think you should be getting, if you are getting call after call after call from telemarketers and you don't know why, anything that you find suspicious regarding anything Medicare related, you're welcome to call us, and we will be happy to sit down and talk to you about what's going on and whether or not it's legitimate and if there's anything you can do about it. And we also help submit complaints to the Division of Insurance and to the federal program. If you want more information about the SMP, you can go to the SMP's website, which is smpresource.org. Colorado also has a toll-free statewide hotline listed on the slide. And of course, we're always looking for volunteers and happy to talk to anybody who might be interested in that. In the email I sent everyone earlier, I did include a handout about volunteering. It is a very rewarding position. This is a very rewarding job to do. It actually truly, genuinely helps people. It is a lot to learn, and it can be a little challenging, but it always keeps you interested, and there's always something new to learn. So it definitely keeps you interested, and there's never a dull moment. If anybody's interested, again, please shoot me an email or give me a call. And with that, we are done. Any last questions before I let you all go for the evening?
Hello.
I hear you now.
Is there a chance I can get an appointment so I can buy supplement insurance? I've already currently got my Medicare card, and
Okay.
I'm looking to do the Part C and D and the supplement insurances.
Okay, so next week we are going to talk in depth about Medicare supplements, also known as Medigap, and Medicare Part C, also known as Advantage plans. So we're going to talk about those two options in depth, what they are, how they work, what they cost. And then if you want to schedule an appointment to sit down and look at those options on a one-on-one basis, I'm happy to do that.
Okay.
You can either give me a call and we'll schedule something, or you can shoot me an email and we can schedule something.
Okay, I'd like to do that.
But yeah, we're going to talk about those two things specifically in depth next week.
Okay. And the appointment, the online course for next week, are you sending out an email what day that is?
It's going to be all 4 of these presentations are going to be Thursdays at 5:30 every Thursday. I do apologize. I usually send out an email, a reminder email that includes the handouts hours before the presentation starts. For some reason, my email did not actually send it when I hit send earlier today. But I also try and include a link in that email to the presentation. So I promise I'll send that email out with next week's handouts much earlier in the day, so people will have a chance to get it and be reminded well before 5:30.
Thank you.
Any other questions or comments? All right. I really appreciate your guys' patience and hanging in there with us tonight. I know it's a lot of information, but hopefully you'll find it useful. If you have any questions in the meantime, you are welcome to send me an email or give us a call, and we're happy to talk to you during the week. Is there another question?
No, just wanted to say thank you.
Oh, you're welcome. Thank you. I appreciate that.
Yep.
All right. Well, with that, then I will let you all go for the evening, and I will hope to see you all next week at 5:30 to talk about supplements and Advantage plans.